Uganda has been the only East African country without an immunization policy, a fact that ranked its immunization coverage lowest in the region. The cabinet-approved policy will ensure the availability of safe vaccines for preventable diseases among targeted audiences, quality immunization, proper waste management and strengthening the legal framework.
Ensuring the availability of safe, potent and effective vaccines for targeted diseases among the targeted population and age group. Strengthening coordination, support and accountability of health management structures for quality immunization and service delivery in Uganda.
Because of the lack of the National Immunization Policy, Uganda's gains immunization against polio, tuberculosis among other preventable diseases was declining, yet the country had been rated highly before the political turmoil of early 80s. Cabinet has now directed the Ministry of Health to gazette and disseminate the policy to stakeholders and all Ugandans.
Comprehensive immunization program between 1962 and 70, achieving high routine coverage of infants, especially to polio and tuberculosis. The country became one of the first in Africa to be certified for smallpox eradication in the early 70s, but due to political turmoil and civil unrest in the late 70s and 80s, the coverage dramatically dropped.
It is hoped that the policy will help reduce prevalency of immunizable diseases. The policy intends to also involve the community to a greater extent in supporting and providing immunization services to the children and childbearing women. In another development, Cabinet has also approved the Kasese Disaster Recovery Plan 2014-2015, a comprehensive response to the recovery needs of the affected areas and surrounding communities by reducing their vulnerability and enhancing their resilience to possible disasters of a similar nature.
Cabinet therefore noted the magnitude of the destruction that had occurred as a result of the heavy rains which caused floods and directed the Ministry of Finance, Planning and Economic Development to avail funds amounting to Uganda shillings 39 billion to facilitate the relocation and resettlement of people in all areas that were highly prone to landslides and floods.
Cabinet has therefore asked the Minister of Finance, Planning and Economic Development to front-load the money contained in the budget for financial year 2014-2015 to various sectors to facilitate the implementation of the critical activities of Kasese District Disaster Recovery Plan to prevent recurrence of floods likely to result from the El Nino rains expected in September 2014.